So this is the how to set up the emergency equipment for any high-risk patient, but especially like your MAG patients. So this blue bucket should be in your nurse server on the top shelf. It has all your oxygen and suction supplies in it. So we're gonna take this and set up the room. So at the head of the bed, all the patients have this picture. We're gonna push the picture all the way up. And you'll see underneath that you have your oxygen and your suction. What you need to do to make them work is turn them out and you'll feel it click. That means that you're in the right position, that you will get airflow through them. You may have to work with it a little bit just to get it to the right spot. Then once you're there, depending on whether you're going to possibly need it or if it's just for an emergency, you have your non-rebreather and you have your nasal cannula. If you're not needing it at the moment, it is okay to leave the package kind of sitting here so you're ready to go in case of emergency. But if you need to open it and hook it up, you would just go ahead and unpackage it. And on the oxygen, there's the little tree on the bottom that goes into this tree. So work it on there and then just turn it up to whatever volume you would need. So that's your oxygen setup. To do your suction setup, you need a couple of things. So you're gonna need the white ring. This is what's gonna hold your suction canister. So there's like a rim. The rim goes on the top. So you're gonna slide that into this silver holder on the wall. You're gonna get your canister and make sure that your top is pushed on all the way. In addition, you have 3 ports on the top. You need to make sure the caps are on them, the ones that you're not using. So we're gonna leave this one open and this one open. We're gonna slide our canister into the top. Your tubing, it's conductive suction tubing, the short tubing. You're gonna open that, and that goes on the port that you left open on the top, and that goes on the bottom of the suction here. You're also gonna open a longer set of tubing, and this is what you would use if you had to suction the patient. So you're gonna open this up. You're gonna connect to the white L-shaped connector on the top, and then you have your tubing. The last piece to this is your Yankauer or your mouth suction piece. So you're gonna open this, pull out your port, put your Yankauer in there, and this is what you would use. The part that has the little holes at the top is what you use in the patient's mouth, so just make sure you connect the right end. So you could leave this whole entire thing all set up for your MAG patient anytime you're gonna have one, or any other high-risk patient that you feel could use the emergency equipment. The last piece is if you're hooking up a pulse ox. So you have your pulse ox machine. This one happened to come with the cable attached, but if you don't have one, there are extra in the high-risk cubby. This goes right into the back of the machine, and then you take your other end and you plug it into the responder IV, number 1, so that if the pulse ox starts to read low, it will alarm as an AUX alarm for this room. That's it.